Alteration in the blood flow. So before going into the alteration in blood flow, I want to say two uh, words which come into this slide, and what is the meaning of this is turbulence and stasis. Turbulence means unequal flow, and stasis means flowing. So after knowing the meaning of these words, we'll go into the actual what happens in the alteration of in the blood flow. This step, the thrombogenesis, what happens is normally what happens, there is an axial flow of blood. What do you mean the axial flow of blood is? In the central stream, there is WBCs and RBCs flowing in a blood vessel. So imagine a blood vessel. In that, a central stream consists of WBC and RBCs. Adjacent to them, platelets are there. So the peripheral most part consists of the plasma, which is close to the endothelium. This is the normal blood flow. In thrombosis, what happens is this turbulence and stasis occur. Turbulence and stasis, which I have already told the meaning. In first stasis, we'll see there is a slowing of blood. So at this time, what happens is when blood slows down, the blood cells, which are the WBCs, RBCs, and platelets, will marginate to the periphery. So they usually should be at the center. They will marginate to the periphery and form a pavement close to the endothelium. And stasis will allow a higher release of oxygen from the blood. Yeah. And it initiates venous thrombi even without evidence of endothelial injury. So even if there is no endothelial injury, the stasis of blood may cause venous thrombi. So, and then next is turbulence. Turbulence means unequal flow. So, unequal flow of blood will injure the endothelium, resulting in the deposition of platelets and fibrin. And then formation of arterial and cardiac thrombi is facilitated by turbulence in the blood flow. So, what we came to know is the stasis is responsible for venous thrombi even without the evidence of endothelial injury, and turbulence is responsible for arterial and cardiac thrombi. Okay, next we'll go to the next. I think this is the last step of thrombogenesis, that is hypercoagulability or thrombophilia. What do you mean by thrombophilia? Thrombophilia is a condition having increased risk of predisposition to develop venous thrombosis. This condition may be hereditary or acquired. Hereditary means by birth, or acquired means after birth. You have acquired it. Thrombophilia, these people have a predisposition to develop venous thrombosis. Primary factors are the hereditary factors, and secondary factors are the acquired factors. First, we will see the primary factors which are responsible for thrombophilia. Deficiency of antithrombin 3. So, it is a clotting factor. Deficiency of this will cause venous thrombosis. Okay, then the deficiency of protein C and S may cause thrombosis of deep vein, leg veins. And mutation in factor 5 lead-in will cause thrombophilia, and defects in fibrinolysis. Fibrinolysis is actually dissolution of a fibrin. If it doesn't take place, the fibrin meshwork should be dissolved normally, but if that does not take place, it will cause thrombi. So defects in fibrinolysis and increased level of clotting factor 2 and 8. And the secondary or acquired factors, what we can see is 3 factors are there. So risk factors of usually, what are the risk factors for which this venous thrombi or thrombophilia can occur is advancing age. So in the old aged people, thrombophilia may occur. prolonged bed rest. Actually, it is not bed rest, bed rest, and prolonged immobilization. This it is same as bed rest. And cigarette smoking, obesity may all be the risk factors for thrombophilia. Then predisposing clinical conditions. So, in what and all clinical conditions thrombophilia may occur is in the heart disease, vascular disease, hypercoagulable conditions, shock, late pregnancy, tissue damage, antiphospholipid antibodies syndrome, that is APLS syndrome. This may also cause thrombophilia, lupus anticoagulant antibody, and anticardiolipin antibody. Okay, next. Okay, now we saw the thrombogenesis and how it occurs, the pathogenesis of thrombogenesis, all those things we saw. And next we'll be seeing is an important topic called as general morphological features of thrombi. So morphological features, it will contain gross and microscopic features. So what are the gross features? How does a thrombi look grossly? So it is usually of various shapes, sizes, and composition. How does this shape, size, and composition, or what does it depend on, is on the site of origin. From where does it origin? Usually it is a venous thrombi or arterial thrombi, or it may be a mixed or laminated thrombi. Okay, so there is 3 types of origin of this thrombi. First, we'll be seeing the arterial thrombi. Arterial thrombi, it tends to be white. Okay, so white arterial thrombi, usually everyone will think that it will be red. So no, it is a white. White means it will not be white only. So comparing it with venous, it is told to be white. And mural, what do you mean by mural? Mural means it will be attached to the blood vessel. Okay, then venous thrombi. Venous thrombi are red and occlusive. Occlusive means it is going to block the blood vessel. Arterial thrombi is attached to the blood vessel and venous thrombi will block the blood vessel. Okay, venous thrombi is red, arterial thrombi is white. So we'll usually interchange the wordings for arterial thrombi is white thrombi and venous thrombi is red thrombi. We'll be interchanging the words like that. And then mixed or laminated thrombi, it is also very common, and it consists of alternate white and red layers. So these alternating white and red layers are called as lines of Zahn. Okay, so how does this red thrombi look? It is soft. Red thrombi is, we already discussed, it is an venous thrombi. It is soft and red and gelatinous. White thrombi is firm and pale. Okay, so let us go to the microscopic features. Okay, what is the composition of thrombi? It is determined by rate of flow of blood. What is rate of flow of blood is how fast, whether it is a rapid flow or it is a slow flow. So rapid flow, where does it usually occur? In the arteries, and slow it will occur in the veins. So the composition will depend on the rate of flow of blood, whether it is formed by a rapid arterial and cardiac circulation or in the slow moving flow in arteries. The lines of Zahn are formed by alternate layers of light staining aggregated platelets admixed with fibrin meshwork. So here we saw the line of Zahn where it is found in the mixed thrombi. So these lines of Zahn are formed by, okay, we saw that it was formed by white and red layers. So the white layer, which is the light layer, is usually formed by the platelets with the fibrin meshwork, and the dark layer, that is the red layer, is formed by the red cells, and the red thrombi, which is the venous thrombi, have abundant RBC, WBC, and platelets entrapped in the fibrin meshwork. Thus, red thrombi resemble the blood clots in vitro. Okay.